Peripheral neuropathy symptoms. What are they? You are watching a production of GoodHealthTube.com. Before we discuss the symptoms of peripheral neuropathy, we will briefly mention the four main types of peripheral neuropathy. If you are interested in learning more about peripheral neuropathy, including causes, treatments, and diagnostic tests, see our other videos in our neuropathy playlist. A link is in the description. Later in the video, we will mention a profound scientific discovery that has important implications for neuropathy. Types of peripheral neuropathy. Each type of peripheral neuropathy has a unique set of symptoms and prognosis. To assist physicians in classifying them, they are frequently divided into the following four categories. 1. Motor neuropathy. 2. Sensory neuropathy. 3. Autonomic neuropathy. And 4. Combination neuropathy. The remainder of this video will discuss in detail peripheral neuropathy symptoms. Motor neuropathy symptoms. Motor neuropathy is a disorder of the peripheral nervous system that affects the ability to move and control muscles. It can cause pain in the arms and legs, as well as other symptoms. Knowing what signs and symptoms to look for can help detect motor neuropathy early on so it can be treated promptly. Common symptoms of motor neuropathy include muscle weakness and atrophy, or loss of muscle mass, impaired balance and coordination, poor reflexes, decreased sensation in extremities, painful cramping or spasms in muscles when moving or at rest, stiffness in joints especially after resting for extended periods of time, difficulty walking due to weak legs, difficulty eating due to weak facial muscles as well as difficulty speaking from weakened tongue muscles. Other signs could include fatigue caused by overexerting weakened muscles. Sensory neuropathy. Sensory neuropathy is damage to the nerves responsible for communication between the body to the brain and spinal cord. Sensory nerves regulate sensations such as pain, temperature, and light touch. It can cause a wide range of symptoms, including burning or shooting pain in the extremities, numbness and tingling sensations, sensitivity to touch or temperature changes, and loss of coordination. In some cases, it can even lead to complete loss of sensation in certain areas of the body. The most common symptom of sensory neuropathy is abnormal sensations, such as pins and needles feelings or burning pain on the skin. People may experience these sensations throughout their entire body, but they typically start at the feet and move up towards other parts like hands and arms. Autonomic neuropathy. Autonomic neuropathy is a type of nerve damage that affects the autonomic nervous system. This system controls involuntary actions such as breathing, blood pressure and heart rate. Symptoms associated with this condition vary depending on the type and severity of nerve damage present in the body. Common signs and symptoms can include lightheadedness, dizziness, blurred vision, constipation, nausea, vomiting or diarrhea, abnormal sweating, and difficulty maintaining proper body temperature. In addition to these physical symptoms, those living with autonomic neuropathy may also experience mental health issues including anxiety or depression due to their diagnosis. Additional symptoms can include incontinence or bladder problems, irregular heartbeat, difficulty swallowing, impaired sexual function including erectile dysfunction or vaginal dryness, numbness in the hands and feet, and fatigue and muscle weakness. It is important for those suffering from these symptoms to speak to a qualified healthcare professional who can help diagnose and provide treatment options for this condition. Combination neuropathy. Combination neuropathy is two or more of these other forms of neuropathy. Combination neuropathy is usually a type of neuropathy caused by multiple factors, such as diabetes, alcoholism or autoimmune disease. This kind of neuropathy may have different symptoms from those seen in other forms of neuropathy. The most common symptom of combination neuropathy is pain, which can range from mild tingling to burning sensations or sharp cramping pains. Numbness and loss of sensation in the hands and feet are also typically experienced by those with this condition. Weakness in the affected limbs may lead to difficulty standing or walking for long periods or difficulty climbing stairs. Other symptoms include muscle twitching, fatigue and digestive problems like diarrhea, vomiting or constipation. In severe cases, patients may even experience memory problems. Complications from untreated neuropathy. When left untreated, neuropathy can cause considerable complications that affect an individual's quality of life. Neuropathy may present with symptoms such as burning or tingling sensations, muscle weakness, numbness and difficulty walking. If left untreated, these symptoms can worsen over time and become permanent. The most common complication associated with untreated neuropathy is chronic pain, which can be debilitating and interfere with daily activities. This can lead to depression, anxiety, and even suicide. Additionally, other serious complications include infection due to decreased sensation and poor circulation in extremities. Amputations often ensue. Infections can also result from impaired bladder function, making one prone to urinary tract infections. Finally, severe cases of neuropathy can lead to permanent or effective paralysis. Complications of autonomic neuropathy include low blood pressure, multiple fainting episodes making one prone to traumatic injuries, and cardiac dysrhythmias, abnormal rhythms of the heart, that can potentially be life-threatening. The enzymatic process of neuropathy. A discovery of an enzyme that is involved in the development of neuropathy has important and profound implications in the treatment of neuropathy. See the link in the description or the pinned comment below to learn more. A quick recap of this video. There are, generally speaking, 4 types of peripheral neuropathy. 1. Motor neuropathy. 2. Sensory neuropathy. 3. Autonomic neuropathy. 4. Combination neuropathy. Common symptoms of these neuropathies include the following: numbness, burning, tingling, pain, muscle weakness, difficulty with movement coordination, bladder and gastrointestinal abnormalities, blood pressure and cardiac rhythm abnormalities, fainting, paralysis, and depression and anxiety. Before we end this video, we'd like to ask you to like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our neuropathy playlist. Hit the notification bell to be notified when more videos become available. And check out the link in the description or pinned comment regarding the enzymatic discovery that has profound implications for neuropathy. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.